Hello, everybody. Welcome to Dental Voice Season 2. Thank you for joining us. My name is Rolando Mia. The purpose of Dental Voice is to give us an opportunity to hear from professionals about dentistry, hear their perspectives, hear their insights, and then potentially get some, advice from them regarding all of the things that we're experiencing today. We have Dr. Marie Silvestri. We had her on the show about 6 months ago, right before the beginning of this entire pandemic, and she's back with us today. I'm really excited to hear what's going on. Also, I wanna ask her about some of the comments that she made prior to all of this when we knew nothing, and as it turns out, she was spot on. Good day, Dr. Anne Marie. How are you?
I'm fine. Hi, Rolando. Nice to talk to you again.
Well, first of all, thank you for joining us and really appreciate it. So, getting straight into this, it's been 6 months since we talked about this when we first engaged. The pandemic, COVID-19, the uncertainty, all of the apprehension and anxiety was there. And you gave us some advice. What has changed as far as you're concerned between then and now?
Well, it's been interesting because I retired March 27th. Perfect timing for retiring during a pandemic. Uh, I haven't had a lot of firsthand information with the county like I would have, but I've talked to lots of dentists and seen their frustrations, seen their fears, and just work with them to have things done. Lots of ways to do things. Dentists are very concerned. I was really very concerned when they were not allowed to open and considered non-essential at the beginning. And I think, as I said 6 months ago, the dentists have been treating infections. They know how to do this. So I think that was an error. And I think doing that put a lot of fear into people when they were opened again. So I think we're all on a good track now.
So back then, I love that. It's interesting. Back then, one of the biggest issues that everybody was concerned about was this context of how virulent COVID was, and that there was even fear or talk that the dentists and the dental clinics were going to be kind of the center for spreading. We're not seeing that. What are your thoughts around that?
Going back to us dentists having had experience, in the early 80s with the HIV, dental was hit really hard with how to take care of infection control, aerosol, and how to clear that, the use of glasses, the use of masks, the use of masks and gloves became routine in dental in the 80s. It's not routine in medicine. Not every exam has a mask and glove on when you go to a physician. In dentistry, your dentist is always wearing a mask and gloves. And that happened in the 80s. I graduated from dental school in, I don't even want to say this, in 75. And we did not wear gloves. We did not wear a mask. We didn't even sit down when we did dentistry like they do today. So lots of changes that I've seen in all the years. But the biggest change came when the HIV epidemic hit. AIDS hit, and I was in San Francisco, so I saw that. And the biggest change came in infection control. And now with this going on, with COVID going on, the big emphasis is on infection control. So I think that we had a heads up. The dentists had a heads up to the medical population and actually to every industry because they were doing it before.
Do you see a big difference? Or let me ask you this. When HIV hit way back then, there was a dramatic change from the way dentists and their teams were operating. With the advent of COVID, do you see as big or as drastic a change in the operating mode, in the protocols, and the things that clinicians are doing?
So I have to be very careful with this because I was talking to my brother-in-law, who's also a dentist, and when I said I don't see a big change, he almost died. He said, "Oh no, we're doing all these things different." What are you really doing different? You're wiping down counters as you did before. You just wait longer in between. You're wearing masks as you did before, but you wear them constantly. When you go out to greet the patient, you have a mask on, which you probably didn't before. You're wearing a shield, which many dentists did not, but some did. And as I said 6 months ago, was something we had started even 2 years prior for the county. So we were wearing shields. You're being really careful about suction. You've always had high speed suction. You just didn't turn it on all the time. So several years ago, we purchased isolites that gave us constant high speed suction. Today, I think, and I'm not sure what they're called, they're big units that come, and I want to say like a point of service suction to you, which you didn't have before. You have shields at the front desk, which you may or may not have had before. I mean, there are changes. I don't want to say that they're not. I think the changes became in thoroughness, time, and awareness.
So, that's, it's interesting. It sounds like prior there was a mindset around it. It just magnified the requirement to pay more attention to how, or I guess the process. Is that what I'm hearing?
Yes. And one of the things I think that was a change is you had several patients. And so when you were done with the patient, the assistant immediately went in and started to clean the room. One of the things with COVID, the advice is to not go in right away. Get the patient out, get the patient settled, wait 5 minutes, then go in and start to clean the room. That would be a change. You don't
Hmm.
have two patients cross each other because you don't want them to contaminate each other if one happens to be sick. So that's a change. I mean, I'm not going to say there's no changes, but the
Right.
changes were very easy for dentists to adapt to.
And by easy, it was just enhancing. It sounds like it was enhancing what kind of was in place and paying more attention as opposed to like requiring a completely different change in the way they did stuff.
Exactly. Enhancing your awareness. I don't even want to say enhancing your infection control, but it's enhancing your awareness, slowing down the number of people that come in contact with each other. I mean, my son's an orthodontist and he doesn't have the full wait in the waiting rooms anymore. Everybody waits outside, gets called in one at a time. You'll have one in a chair, one in a waiting room, one somewhere else. And I think that's pretty much the norm. And it's not only the norm in dentistry. I had a podiatry appointment, and luckily, this is on a storefront area, and there was parking in the front. And they literally, you park your car, they bring the papers out to you, you fill them out, and then you go in. So it's just the contact, patient to patient contact is very, very minimalized now.
Would you say that the patients and the I guess the people coming in are feeling better, or would you say that they're still, based on everything that you've heard, people that you've talked to, teams you've engaged with, would you say that patients are more or less, let me just say, concerned about this? What are your thoughts on that?
So I think there's both. There are patients that still refuse to go to the dentist. Man, I have a cousin that called me and wanted really, should I go? I'm due, blah, blah, blah. Yes, you should. Um, there are patients that are afraid to go in. I've heard that from many dentists or people that are just don't want to go in. There are those that are anxious to get back on track. So I think like everything else, it's very personal. And I think they have to be comfortable in themselves. You know,
Right.
the person that goes to the party is not going to have a problem going to the dentist. But the person and I met someone yesterday who had not been out of the house since March 15th.
Oh, wow.
It was their first time out. We did a road rally for polio, and that was the first time she went out since March 15th. And this is what was October 26th. She had food delivered. She talks on the phone, has not been out of the house. So those may be a little bit more apprehensive to go anywhere. And dental, with all the talk of aerosol issues, may heighten their fear.
So from a leadership, from a dental perspective, there are still teams, it sounds like, or we've heard, who are still kind of struggling with or haven't fully gotten their heads wrapped around reassuring their teams that this is a safe environment. What advice or kind of what feedback or perspective would you want to share with those teams who are still dealing with that?
So the team leader needs to be secure and safe within themselves. And I'm going to go back to the 80s and the AIDS epidemic. And I mentioned it 6 months ago that being in San Francisco, one of my main referrers was very active with San Francisco AIDS Foundation and AIDS. So many of my patients converted as it is. And I literally sat down with my staff. It was an education experience. We just had, you have to learn to take care of yourself, to take care of your patients, and feel secure. A team cannot feel comfortable. And by a team, I'm talking about, and I assume you mean the front desk, the assistant, and the dentist cannot be comfortable if the dentist is not comfortable. So the dentist needs to be comfortable that the surroundings are secure and safe and infection free. I mean, what we hear today is wear your mask, wash your hands. I don't think anybody washes their hands more than a dentist does. I mean, we wash our hands before we put on the gloves. We wash our hands. We take off the gloves. You go to the next room. You wash your hands. You put on the gloves. I mean, just reinforce that and see that it's protect yourself.
I'm curious and I'm really interested to understand when you say you need that. How can a dentist or how can you establish that kind of, I don't know, protocol or process in a clinic or on your team? What are your thoughts on doing that?
I don't think it's a new process to put in. That's what I'm saying. I mean, I don't think I'm going back to the clinics that we had at San Mateo. We have 5 dental clinics. Every
Right.
one of the clinics had their infection had a standardized infection control cleaning procedure. We had a standard way to clean instruments. We had a standard way to clean each operatory. If an assistant went from one clinic to another, or the dentist went from one clinic to another, there was consistency. We were also very lucky to have an infection control team that was affiliated with the medical center. Um,
Mm.
and they made sure that we were comfortable. And if I could do a shout out for Dr. Grace Seed and Michelle Madrano, they were the 2 people from San Mateo Medical Center that honestly, they kept us on our toes and they followed through. So I felt like we were in a very secure environment. We were in a infection free. We knew what we were doing. We think we knew what we were doing, and we made sure we knew what we were doing. So coming with it now, yes, there's an increase. There's the HEPA filters, but many offices already had those. There's the aerosol suction, the high speed, keep it going, make sure it's on. For us, it's the use, and for many offices, and actually even dental schools in San Francisco, they have the isolites, which are continuous suction. Continuous high-speed suction is necessary, but you don't always have the assistant there to do it. Hence the need for the big machine to come out and do high-speed suction, or something like an isolite, or having the patient hold something next to them so they can get the suction. It's just important to pick up that aerosol spray. More important than it used to be.
There you go. Exactly. So let me ask you this. It's interesting, and you mentioned an infection control team, especially at the San Mateo Clinic, which sounds phenomenal. In a dental practice, how can you establish, or they helped in establishing, I guess, compliance with those processes. What are your thoughts on if a practice chooses not to enhance that or continue business as usual or process as usual in a post-COVID kind of environment? What feedback or what are your thoughts or opinions regarding that?
So to keep your dental license, whether it's an RDA or a dental assistant, a hygienist, or a dentist, you need to take OSHA infection control and dental law at least every other year.
Mm.
So at the medical center, we had someone come in and teach that to the group. So if you're following what you're learning in that class, there should not be an issue. Usually there's a lead dental assistant or an office manager, and it would be their job to see that this is followed through. One of the things that we did, we had lots of logs on when the instruments went out, logs on You know, we didn't have a log on cleaning the
Mm.
room, but I mean, it was pretty much that way. I mean, you knew that the room had to be cleaned. We had signs to show on our equipment. There'd be a dirty or a clean sign, so you knew that if there was no sign, there was a problem. You had to figure out what it was. There was always a sign that said dirty, a sign that said clean. So we knew what was going on. We knew that the room was fresh and had been redone. That was processed prior to all of this. The difference now, I think, is the wait in between and the enhanced awareness. Patients are now more aware. I would think that
Mm.
patients came in and they didn't notice that we did these things. Now they're looking. Maybe.
So when we last spoke, you mentioned, and it's amazing that out of the gate, communication. Make sure that you, your team, and patients know, or make sure you're reinforcing, you make sure you're communicating all that's happening. Is that still going on, or how important?
I think
How
that's
did you know that?
I don't know how I knew that, but it is important because I would tell you that the general public 8 months ago, and if you said make sure you have proper PPE, they would have no idea what you're talking about. I think today they know PPE is proper personal equipment, whether it's your glasses or your paper smock or your mask or all that. It's become pretty evident that everybody wears those today. We wore them before. I just don't think people notice them. So there are differences that are coming on because we've had to make differences. But I think that the dentists were best able to pick up these changes and implement them quickly because it wasn't totally new.
Can you hear me, Dr. Silvestri?
Here now, I couldn't before.
Okay, okay. I'm sorry, I missed that last part. You said they knew it before, but
But they had to enhance them a little bit. And now patients are looking to see if they're using disposables. And I can tell you that disposables are really on the rise because everyone that I talk to tells me that the cost of masks that used to be maybe $5 a box are now 15. The cost of everything has gone up. You know, they say what the society will bear, and you've got to buy them. So you know, but I think it's people are more aware. I mean, did you ever go to Costco and see as many masks as you see on sale there today?
no, no, absolutely not. That well, I have to bring up. It's interesting how in the hysteria, toilet paper. Do you remember that toilet paper
Yeah.
was this big, gigantic thing? Now you hear nothing about it.
Well, I hear they're starting that I just had read something that people are starting to stock up again. For some
Oh my
reason,
goodness.
they're starting to stock up on everything again. But
So
they said commercial people are ready. You can
this
stock up.
time.
We'll send you more. Yeah, you won't be
So
out.
with that in mind, what we're seeing happening now, another, I don't know whether you want to call it a wave or another increase in cases that are coming up. How do you see that? I mean, affecting, do you think that's going to shut us down again from a dental perspective? Because back then, dentistry was considered quote unquote non-essential. And when you look at the results so far, cross your fingers, very few, if any, COVID cases are coming from the dental environment, which is a great testament to kind of the protocols that are in place. But now that cases are rising again, we're having this fatigue. It's going to go in. How do you see that affecting dentistry, and what would you tell dentists and clinicians to prepare for that?
So you hit on what something that I was going to say. To my knowledge, none have originated in a dental office. There's been no transmission in a dental office. Whether people want to believe that or not, I don't know. How people's fears are inherent. How they come out, I don't know. I mean, you see people that'll hear all this stuff and they're still going out. I mean, they're still traveling, they're still doing everything. So those what makes them different from this lady that I said that had not been out of the house since March? So I can't prophesize what's going to happen there. I do think that if there is another big shutdown, it will not shut down the dentists. I think that we've proven that we can handle this and it's fine. I've always said, the mouth is the portal to the rest of your body. So what makes this so different than anything else? A lot of systemic diseases can be seen in the oral cavity. So why are we eliminating this one source? The truth is we can't do this. We can't have a virtual dental appointment. That's pretty true, as you can do some virtual medical ones. But I don't see the need to close dental down. I really don't. But I'm not the one that would make that decision.
So from a process perspective, as clinicians are kind of bearing down for this, I'm going to call it a next wave. I don't know what you want to call or whatever. And do you see anything extra or based on everything that you already know, that you would say our clinicians, practices, clinics, is there anything extra you feel that's important to do as we enter another phase or another cycle of this whole pandemic?
The only thing I can say is to stay aware. Stay aware. Stay aware. Hearing people talk about medical things now on the news, you'll hear someone say, if you have something wrong, don't be afraid to go to the doctor. It's the same as with dental. Don't be afraid to go to the dentist. From a patient perspective. From the dentist and the dental team perspective, continue your awareness. Continue to take the time. Continue to be thorough. Continue to do what you've been doing in the enhanced way that we've now started to do it. I mean, I guess that's all I can really say, but it's like it's human nature to kind of back down a little bit. Don't.
Right.
Don't.
That's a really good point. Yeah, we were becoming lax because, hey, check, no cases over here, so and then boom. So what's new with you? What's been going on? Is there anything else that you've been kind of pursuing?
Outside of being an Uber driver for my kids and grandkids, that's my new job. I seem to be available. I've taken a more active role with the San Mateo County Health Foundation, which is a nonprofit that feeds into the medical center. They were very active at the beginning of the pandemic in getting PPE for the hospital, and the community was just so generous to give back. We had a new CEO, John Giroux, that just jumped right out there, and he got a lot of help for us. So I'm very proud of what the foundation's been doing. The other thing that I've gotten into, I got this email, which I kind of laugh at in a little way. And it said, dear Dr. Silvestri, we know you've retired. So if you have no interest in doing any more in dental, don't read the rest of this email. That was the gist of it. And it was from Foothill College. And it turns out that their dental assistant and hygiene department are interested in doing some kind of a clinic, a mobile clinic or a stand clinic. And so I've been working with Foothill, and I'm real happy to say we did get a grant of $100,000 to start the project. We have another one that people are talking about giving to us. And it'll be exciting. The purpose of this is to train assistants and train hygienists to work in this area or to go anywhere, and also to offer dental services at a reduced rate for the students and people that live in the area of the school. So it's very exciting. It's very beginning. I haven't even been out there to look at the property, but we've been talking a lot. So I'm excited about both of those.
That is fantastic. How do you see COVID affecting education? That you're talking about, participating in, especially on the education side, dental assistants, hygienists. How do you see it affecting the kind of what will change with regard to the education that new or young professionals are going to be experiencing because of it?
So, I'm active at UOP more than UCSF, but have a communication with both. The students are using mannequins more than they used patients in the past. Again, this is to get rid of the crowding. If you've ever been to a dental school clinic, there's lots of dentists, lots of patients all together. So they've split that up. And I don't know what effect that's going to have. I can also tell you that the boards that were patient based up until COVID, especially for the Reds in California, the last one was done on a mannequin. There's been talk for a long time if the tests can just be done on a mannequin. Do we really need to have a patient there? And there are other states that don't use live patients that do use mannequins. So I think there may be a wave of that coming in. Is that good? I don't know. And I was taught where we had to do all these things that these students don't have to do anymore. So, the old way is I had to do it, but it might be the wave of the future. I think that the requirements are going to lessen because it just has to be. They just can't get as many patients in because you can't fill the clinics as much. We have a rotation where UOP and UCSF students go to outlying clinics. I know that the medical center has not reinstated that program yet. So that's a hindrance for the students because they always told us when they came to the medical center that it was a really good learning experience because they were now thrown into a real environment. So I don't know. I really feel for the students that are there right now. People that will be going in the future, we'll get it together. We'll have it.
What advice would you give a young or a person, not even young, who is considering becoming a dental assistant or becoming a hygienist or becoming a dentist? What advice would you give them with regard to entering into this profession, given all this, everything that's going on?
That's not a fair question to ask me. I loved my profession. I loved every aspect of it. I loved having a private practice. I loved working in the community. I loved going into administration. I loved being part of the dental schools. I would do this all over again. But I can't tell you what the future is going to be. Let me tell you, there's always going to be teeth and there's always going to be a need. So you'll always have a job. And don't do anything for which you don't have a passion. So if your passion is to help people, work in dental, like to do the little things that I say we did, make things work, then go ahead. Because if you get a job for which you have no passion, you will not be happy or successful. That's just my thought.
I love the sentiment behind that. What a fantastic message. Don't do something that you're not going to be happy doing. And, like anything, the message I got from you is when you have that passion, you will overcome all the little things that drive you crazy. And I love that. If you were to sum up and kind of what would, put together as a kind of a closing statement, as a message for the community, for colleagues out there, for patients, what's the message you'd like to give to them as kind of we pull this together?
So I would just say be aware. Be aware of your surroundings. Think of others. Wear your mask because it's really a necessary thing right now. Wash your hands, your mask, wash your hands, be considerate of others, and don't be as fearful as many people are today. Be aware.
Be aware. Oh, fantastic. If people wanted to contact you or ask you questions, what would be the best way to do that?
Okay, so I have an email and I'm going to hold it up here if you can see it.
Oh, there you go. Here, let's pull you back out.
Okay. It's Silvestri Anne Marie at gmail.com.
Oh, very good. Very good. Well, that is fantastic. And if people have questions about the new clinic that you're working on or the education, what would be the best way to just come back to you?
Same way. Email me. And if you're in Foothill is in the Silicon Valley, San Jose, San Mateo area, Mid-Peninsula. And we'd like to get whatever help we're going to get. I'm not even sure how this is going, but we're progressing slowly but surely.
Well, Dr. Anne Marie, I personally want to thank you so much. You made a couple of comments and gave advice 6 months ago, and the majority, it's kind of crazy if you have a chance to watch Dr. Anne Marie's prior Dental Voice session back in April, at the end of April, and listen to the comments that she made. She was spot on, and that's kind of why it's great to have her back on. And I asked her opinions about a couple things. So in several months, 3 months, 6 months, would you be open to joining us back and kind of sharing how things are going and all that type of stuff? Is that okay?
Hopefully it'll be, now that COVID is over, what do you
Now that, oh my goodness. Or now that COVID is over and we're dealing with this now, what do we need to do? Help
what do we need
Dr. Silvestri. But it's, first of all, it's so great that you've taken the time. I really appreciate that. I love the fact that you're an Uber driver for your kids. I'm sure they love that. And I love the message. If you're not interested, don't read the rest of this. Like I'm not gonna like you're not gonna read the rest of that. That's great. I'm gonna use that. I'm gonna take that. So, well, Dr. Anne-Marie, first of all, thank you so much for joining us. Hey, folks, those of you who are going to be watching this, if you like the content, please share. If you have questions or would like to engage with Dr. Anne-Marie Silvestri, she gave you her contact information there. If you have any questions for us, or if there's anything that you'd like us to cover, please feel free to reach out to us. Thank you so much, Dr. Anne-Marie, and thank you for taking the time and sharing your thoughts and your wisdom with us. I really appreciate that. And it's always great to talk to you. It's always great to see you. I really appreciate it.
Thank you.
All right. Take care, everyone.
Bye-bye.